Welcome back to MLT 120. Today we're going to do the coagulation lecture. In today's lecture we're going to cover things like hemostasis and the steps of hemostasis, the coagulation factors, the coagulation cascade, and the different pathways within the coagulation cascade. So just a little background here on the coagulation factors. There's 13 total coagulation factors that we'll be discussing within this lecture, and those 13 coagulation factors are numbered or named based on the order of discovery, not the order in which they're activated or needed within the body when blood needs to coagulate. So just keep that in mind when we're going over the coagulation cascade in the lecture here in a few minutes, that numbers are not going to be in order because they're numbered based on discovery order, not activation. And all 13 coag factors are written out here for you except for factor 8. It's AHF, and AHF stands for antihemolytic factor. Antihemolytic factor. So let's first talk about hemostasis. Let's remind ourselves what the definition of hemostasis is. It's stopping the flow of blood when there's vessel damage. Okay, so keep that in mind. So hemostasis depends on a system of checks and balances between thrombosis, which is clot formation, and hemorrhaging. And remember, hemorrhages when there's a release of blood from a broken vessel inside or outside the body. And that both includes both precoagulants, and we're referring to our coagulation factors when we're talking about precoagulants, and anticoagulants. Remember, our anticoagulants keep our blood from clotting. Okay, and there's 4 steps of hemostasis. There's vasoconstriction, there's the platelet plug formation, there's coagulation, and finally there's fibrinolysis. So let's talk about each step of hemostasis. First, vasoconstriction is the narrowing of blood vessel walls by small muscles that are contained within those vessel walls. And if you look over here to the right hand side, you see where the blood vessel has had an injury, so there's an opening in the blood vessel wall, and the vasoconstriction, the little muscles within the vessel wall, is making the blood vessel itself smaller, so it's constricting down and making it more narrow. The platelet plug is formed next. This is where the platelets start to clump together, and we saw this when we were talking about our platelet lecture. And you will see an example of the platelet plug start to form here in the image. Platelets adhere to the injury site and aggregate to form a plug. Next is coagulation. The blood changes from a liquid to a gel form to help form a clot. You see the coagulation phase or step happening in this very last part of the image down here. The formation of insoluble fiber strands and coagulation is happening down here. Okay, for the final step of hemostasis, you have your fibrinolysis, and this is where you basically have the process of the clot not becoming too large. There's kind of a checks and balances because you don't want your clot to get too big, because then it can cause problems within the body. If the clot keeps getting bigger and bigger and bigger, then you could end up with blocked vessels. So the primary function of fibrinolysis is to prevent clots that occur naturally from growing and causing problems. The secondary function of fibrinolysis is to break down clots due to things like illnesses or infections, or even due to medications patients are on. But there can sometimes become problems with that secondary function of fibrinolysis is if fibrinolysis is happening too readily or happening too often in the body. Clots are being broken down too often, or clots are not being allowed to form and stick together. Severe bleeding can happen within a patient. So there's a primary and secondary function to hemostasis. Primary function is where the platelets function, and there's vasoconstriction. Remember, our platelet function is the platelets report to the problem area and call for help from other platelets. So the platelets all clump up together. And vasoconstriction is the vessel spasms and constricts, and it constricts down to help slow the flow of blood. And this happens, the primary step happens, and it happens rapidly. This is a short-lived response to vessel damage. The secondary response is an activation of a series of coagulation proteins. And when we're talking about coagulation proteins, these are our coagulation factors that we mentioned earlier on. These are those 13 coagulation factors in your blood plasma that helps form the fibrin clot. Let's talk a little bit more in detail about the process of vasoconstriction and the platelet plug. Of course, the coagulation process begins with vessel injury. The vasoconstriction occurs, and again, that's the narrowing or constriction of the blood vessel by the small muscles that's contained within the vessel wall. And the whole purpose of this is to help stop or slow down the flow of blood within that vessel wall. And then the endothelium. And the endothelium is just a thin membrane that lines the inside of the blood vessels. So those endothelial cells contain connective tissue such as the elastin and collagen, which stimulate thrombosis. And thrombosis, again, is clot formation. Also, the von Willebrand factor and thrombin helps participate in the formation of the platelet plug and the clot formation, and also the activation of your coagulation proteins, or another term is just coagulation factors. The platelet plug formation activates your tissue factor, which is also known as thromboplastin, and thus it initiates the whole coagulation factor cascade. And we'll be learning about the cascade here in just a minute and the different pathways of the cascade. Okay, for our coagulation factors, or our coagulation proteins, however you want to refer to them, just to remind us, we have 13 of them. And in the secondary hemostasis, it involves the cascade process of the coagulation factors, with the end result being the formation of the insoluble fibrin clot. And there's also multiple enzymes that are required in the process of the coagulation cascade. For our coagulation factors, they are produced in the liver except for factor VIII, which is our antihemolytic factor, or AHF, which is believed to be produced in the endothelial cells. Remember, the endothelial cells line our blood vessels. And our coagulation factors circulate in the plasma in an inactive form until they become active when the coagulation cascade is initiated. If you'll look here, this image represents a cross-section of a blood vessel. You can see the smooth muscle that is on the outside lining of the blood vessel wall. You will see the endothelium lining the inside of the blood vessel wall. you'll see things like your platelets and also your coagulation factors that would be in an inactive form within your plasma. And once there is an injury to that lining of the blood vessel wall, then those coagulation factors would be activated and called into action. And then finally, you would have your clot formation and hopefully the healing of your vessel wall injury down here at the bottom. Okay, so there's two different pathways, like I said, for the coagulation cascade. So there's initiation of clotting that may be activated by one of these two pathways. There's the intrinsic and there's the extrinsic. In the intrinsic, this usually occurs from trauma within the vascular system. So something's happened within the blood vessel walls, such as exposed endothelium. And this usually is a slower system or a slower pathway. With the extrinsic, it's initiated by external trauma, such as a clot or something that happens quickly. It's usually a tissue injury or a break in the blood vessel wall. Tissue factor, thromboplastin is usually involved. Remember, thromboplastin is our factor 3. So here's our first look at the whole coagulation cascade flow chart. Here's our intrinsic pathway on this side, extrinsic pathway on this side, and then we also have a common pathway where they come together down at the bottom. Also, just to remind us, here is our coagulation factors. Remember, they're numbered in order of discovery, not activation in the cascade. We will be discussing the intrinsic pathway and extrinsic pathway separately and the common pathway. But just so you can interpret this flow chart, the solid circle is in the inactive state. The star shape is indicating a active state. These little small A's beside of a coagulation factor means it is in an active state. But we will go over each pathway in more detail on the coming slides. Our coagulation factors can be classified into 3 different groups. The 3 groups is fibrinogen, prothrombin group, which is a vitamin K dependent group, and a contact group. And we'll go over each of these groups in the next slides. In the fibrinogen group, we have coagulation factors 1, 5, 8, and 13. They are consumed up during the coagulation cascade. Factors 5 and 8 are liable, meaning they change or are easily altered and will increase during pregnancy and inflammation of a patient. The prothrombin group, or the vitamin K dependent group, is factors 2, 7, 9, and 10. Their synthesis is dependent on your vitamin K. The factors are usually stable and remain preserved in stored plasma. The third and final group is the contact group, and it includes factors 11, 12, and precal, which is prekallikrein, and HMWK, which is high molecular weight kininogen. Precal and kininogen are both plasma proteins. These factors are involved in the intrinsic pathway, and these are moderately stable and are not consumed during the coagulation cascade. I just want to quickly point out that we will be referring to the coagulation factors mainly by their numerical names, but they do have alternate names that you will hear, and I just want to point out a couple that you'll hear. Fibrinogen is factor 1, prothrombin is factor 2, thromboplastin is also referred to as tissue factor, and that's factor 3. So those are some of the ones that you'll hear more often. Here's the last half of the coagulation factors with their alternate names. These you won't hear their alternate names as often, but one of the factors that you'll hear the most about is factor 8. A couple more points of information that we need to point out for our coagulation factors and alternative names is our high molecular weight kininogen is a surface contact factor activated by kallikrein. Our prekallikrein is also known as Fletcher factor and is a surface contact activator and is mostly bound to our high molecular weight kininogen. Before we get into the details of each of the different pathways for the coagulation cascade, there's three main steps of coagulation. There's generation of thromboplastin, and in the intrinsic pathway, this happens with factors 11 and 9. In the extrinsic, this happens with factor 3. In the second step of coagulation, thromboplastin converts prothrombin to thrombin. The third and final main step of coagulation is where thrombin converts fibrinogen to fibrin. And thromboplastin converting prothrombin to thrombin and thrombin converting fibrinogen to fibrin, both of those are part of the common pathway in the coagulation cascade. So just as a quick reminder before we get into the different pathways of the coagulation cascade, the one pathway is the intrinsic pathway, the second pathway is the extrinsic pathway, and then we have the common pathway where they both come together and are the same at the end. So the first pathway we're going to talk about is the extrinsic pathway. And this is initiated by the release of tissue thromboplastin or factor 3. And this happens after there's damage to a vessel wall or trauma to extravascular cells. And so you're going to start out with factor 3, you can see here in the flow chart. And that activates factor 7. That's here in this step right here. Calcium must be present in the intrinsic pathway. Then you've got your factor 10, then factor 5, then factor 2, and then factor 1. But once you get down here, you're more in the common pathway for coagulation. Now let's go over the intrinsic. There has to be some kind of damage to the vessel wall. So the activation happens after there's some kind of induced vascular trauma inside the vessel. So the pre-cal and the HMWK helps accelerate early steps in the clotting process. Then you have the factor 12 and the factor 11. So you see that up here on the first step. There's 12, there's 11, then factor 9 is next, then factor 8. There's factor 8, excuse me. Then factors 10, 5, 2, and 1. And that's more in your common pathway. This also requires the presence of calcium, and our calcium is coming from our platelets. Lastly, we have our common pathway factors, which includes our factor 10, 5, 2, and 1. And again, we saw both of these at the end of our extrinsic pathway and our intrinsic pathway. And our factor 2 represents our thrombin, and our factor 1 represents our fibrinogen converted to fibrin. Towards the end of our coagulation cascade, we have the very important step of the formation of the stable fibrin clot. So factor 1, fibrinogen, is activated by thrombin to fibrin, and again that's helping form that clot. Thrombin activates factor 13, the fibrin stabilizing factor, and it converts the stable fibrin clot to an insoluble stable fibrin clot. And you can see over here in this image, you can see the red blood cells and all the little stringy material that's connecting those red blood cells together is the fibrin clot. So let's talk a little bit more about fibrinolysis. Fibrinolysis, again, is responsible for the dissolution of a clot, or the dismissal or dissolving of a clot. So the process by which a hydrolytic enzyme, plasmin, digests fibrin and fibrinogen results in progressively reducing clots. Normal plasma contains an inactive form of plasmin called plasminogen. But a tissue plasminogen activator called TPA activates plasminogen to plasmin, resulting in the degradation of fibrin. So we also have things that can prevent or inhibit coagulation. Inhibitors are plasma proteins that are natural anticoagulants. They prevent the initiation of that clotting cascade or the coagulation cascade. There are two inhibitors in plasma. There's the protease inhibitors and there's the protein C pathway that are natural anticoagulants in plasma. Protease inhibitors are coagulation factors which include antithrombin 3, which inhibits coagulation by lysing thrombin, and factor 10A, and is potentiated or boosted by heparin, meaning it requires heparin to be effective for anticoagulant activity. Protein C is made in the liver and circulates in an inactive form. The protein C is activated by a thrombomodulin complex. That thrombomodulin complex triggers the protein C system, and the protein C becomes a activated protein C, which binds with free plasma protein S, and that combo of the activated protein C and the free protein X complex then hydrolyzes and inactivates factors 5A and 8A. So that's how it helps prevent coagulation. Here's just a little bit more information on protein S, so you'll know a little bit more about it and what it is. It's made in the liver. It circulates in two forms. About 40% is in free form and is available, and about 60% is a bound form, and it's a binding protein. So there is a condition called a factor V Leiden mutation. It's activated protein C resistance. This is an inherited condition, and you'll find it more in white populations in the U.S. and Europe. It's an increased thrombosis risk or clot formation risk. You'll see it both in homozygous and heterozygous formations. Again, this is a mutation that's affecting your factor V coagulation factor, and it's where the factor V is inactivated by the protein C S complex, and it gets its name from the area in Holland where a lot of descendants suffer from this particular mutation. You can also have inherited disorders that you have a deficiency in protein C or protein S. And of course, we just talked about the inherited factor 5 Leiden mutation that you could also have. If you have any of these disorders, you have a higher risk of clot formation or thrombus formation. And remember, thrombus is a clot attached to the blood vessel wall. This concludes our lecture on coagulation and coagulation factors. If you have any questions or need any further explanation, don't hesitate to reach out, and I'll see you over in the next lecture.